Hello everyone, my name is Atli Alan Cherry, and I'm going to be doing a presentation on the community of Largo. Um, the area now known as Pinellas County was first inhabited by the Timucuan Indians, one of the four tribes in Florida. They cultivated cornfields, constructed homes, and were involved in trading with the tribes of the north. When Spanish explorer Panfilo de Narvaez landed on the Pinellas Peninsula in 1528, he met with great resistance from the Timucuans, and he and his crew suffered the ravages of storms, hunger, and exposure which decimated the exploring party. Over the next 300 years, various parties of French and Spanish explorers attempted to settle the area with little success. In fact, it wasn't until 1823 that Count Odette Philippe, a surgeon in Napoleon's army, became the first permanent settler in Pinellas County. It is argued that Largo gained its name from the city of Largo, Scotland, where several of the area's settlers came from. Because of its central location and rich farmlands, Largo quickly became the center of the area's citrus industry, earning the title Citrus City. The population started booming and growing just from about 1,500 residents in 1950 to over 5,300 10 years later. However, an unexpected freeze in 1962 dealt a serious blow to the Largo's agricultural industry, and as groves were sold off, developers were quick to move in and build homes for a growing population. Today, Largo is a community of more than 74,000 residents and continues to grow through annexation. The city has developed such landmarks as Largo Central Park, Largo Cultural Center, and many others. As far as the community structure is concerned, with regard to health-related services, um, Largo is serviced by Largo Medical Center, which is a 425-bed teaching hospital, which has two campuses in Largo and specializes in open heart surgeries. In addition to this major hospital in Largo, there are other walk-in clinics like Baycare, Urgent Care, Walgreens Health Clinic. Likewise, there are many other clinics in Largo where the residents can get treatment for non-emergent issues. There are various assisted living facilities as well, such as the Cabot Cove of Largo. The Community Development Department of the City of Largo provides a bunch of housing programs to the low-income residents, like the zero-interest deferred payment loan for home repairs if the value of the house does not exceed $150,000. In case where a repair to the home is not cost-effective, those residents may be eligible for home replacement plan under the House Rehabilitation Program. City of Largo has a Community Development Advisory Board which holds meetings every year to discuss about what has been done in the past and also to decide how to allocate the funding for the next year. There's a down payment assistance program which helps low-income residents with up to $35,000 towards down payment on the purchase of their first home. In addition to these, there's also a home buyer class that helps residents who are planning to buy a new house in Largo. All these factors could be the reason that we do not see a lot of homeless people on the streets in Largo. As far as education is concerned, Pinellas high school graduation rate was 81.1% in 2010, slightly lower than the state rate of 81.2%, but a significant increase from recent years, which was 66.4 in 2001. For Pinellas County, the percentage of persons aged 25 and above with bachelor's degree for this period was 27.1%, which is higher than the rate for the state of Florida, which was 25.9%. As far as recreation is concerned, Largo has its own Largo Central Park, which offers a wide variety of recreational facilities to the residents. There is a playground for the kids ages 2 to 12. There is a walking or a running trail for people who wish to jog or walk. There is a huge ground where families can come enjoy football, soccer, or any other sports that they are interested in playing. This park becomes the center of attraction during Christmas for its decorative lights, and on 4th of July, people from all over the city flock here to watch the Independence Day fireworks. There is also the Largo Golf Course, where residents may practice their swing with golf clubs, and then there is the Highlands Recreational Complex, which also offers wide variety of activities for the residents of Largo. As per the 2010 census, Largo has a population of 77,648 residents, of which 86% is Caucasian. 27% of the population is above 60 years of age. In 2012, Pinellas County was ranked 31st among 67 counties in Florida when it came to health outcomes, and it was 15th with regard to health factors. It ranked 29th in morbidity, which indicates poor or fair health. Between 2014 to 2016, STD cases in Pinellas County were 426.3 chlamydia cases per 100,000 in comparison to 449.6 for the state of Florida. However, for the same period, the total gonorrhea, chlamydia, and infectious syphilis cases were 592.3 for Pinellas County as compared to 582.2 for the state of Florida. This shows that there are still a lot of people out there who need to be taught about safe sex practices. In 2011, the leading cause of death included cancer 22.8%, followed by heart disease 22.7%. This was followed by respiratory disease and stroke. Unhealthy food choices, obesity, lack of physical exercise are all factors that lead to heart disease. Tobacco usage among the adults is another area of concern, and in 2010 the rate of active tobacco users for Pinellas County was 19.3%, which was 2.2% more than the state average of 17.1%. This tobacco usage leads to cancer and heart disease, which are a major concern for Pinellas County. Access to health care provider is another concern for Pinellas County residents. In 2010, around 16.1% of the Pinellas County reported as being unable to access their health care provider due to cost. This despite the fact that 74% of adults and 90% of children reported having health insurance coverage. Pinellas County has a shortage of mental health providers as well as dental service providers. In 2007, 17.3% of the adults could not see their dentist due to the cost factor. According to the Healthy People 2020 specific community objects, the three identified objects for this community would be to reduce the proportion of persons in the population diagnosed with hypertension. Hypertension leads to many problems like heart disease, which ultimately accounted for 22% of the deaths in Pinellas County. The second would be reduce the proportion of adults and adolescents and young adults with sexually transmitted diseases such as chlamydia. The STD cases in Pinellas County are higher than the average for the state. The third objective would be to increase the proportion of adults who were counseled about cancer screening consistent with the current guidelines. The figures indicate that cancer accounted for 22% of deaths in Pinellas County in the year 2011. As far as the environment is concerned, City of Largo has a Public Works or Environmental Services Advisory Board, which is composed of 5 citizens appointed by the mayor and approved by the City Commission. The purpose of the creation of this board was to have more input from citizens regarding the operation of the public works and environmental services. City of Largo states that it is prepared for any adversity. However, between June 2016 and September 2016, Largo had an overloaded sewage system. In Pinellas County, 200 million gallons of sewage seeped up through the manhole covers and flooded the streets in 2015. 161.5 million gallons were dumped into Tampa Bay, leading to state and federal investigations. Pinellas County website also has a free mobile app for iPhone and Android devices whereby residents can report any problems with illegal dumping or graffiti. The City of Largo consists of a mayor and 6 commissioners for the city. Their job is to establish the legislative policies, which then will be enforced by the city manager. The commissioners and the mayors are accessible by phone or email, and their numbers and email addresses are listed on the website. Anyone who wants to watch the meeting can go on the Largo City website and click on the meetings to watch the proceedings of the meeting. City Commission meetings are held on the first and third Tuesdays at 6 p.m. The citizens can contribute to the community through advisory boards and affiliate boards, which conducts a meeting each month. The budget for 2018 looks like a well-balanced budget, and almost 15% is allocated towards public works. This seems to be a good idea since we saw the damage that Hurricane Irma caused in 2017. 16% of the budget is allocated to police works, which seems like a good idea in the event of recent school shootings and other law and order situations. As far as areas of public concern is concerned, 54.2% of population has some sort of addiction, whether it be drugs or alcohol. Between 2010 and 2012, 1,253 children were removed from their homes due to prescription drug abuse. In high school students, some alcohol was bought and supplied to them by another person. Obesity was at 35.9%. Among high school students, 37% in Pinellas County did not engage in sufficient vigorous activity. The choice of food also plays a role in developing obesity. According to the Department of Health, 96.2% of adults in Pinellas County live within a radius of 5 miles from a grocery store, yet they end up eating unhealthy food instead of choosing healthy fruits and vegetables. In 2010, 36.6% of people in Pinellas County were diagnosed with hypertension as compared to 34.3% for the entire state of Florida. The Healthy People 2020 goal is for 13.5% population with a diagnosis of bad cholesterol, which is way lower than the rate for Pinellas County for 2010, which was 47.9%. The overall community needs and the problems that the community faces can be arranged in the following order. Prescription drug abuse for the year 2011, as far as accidental death is concerned, prescription drugs were the main culprit. And the number of newborns who experienced withdrawal symptoms were in the triple digits in 2010. Second is the mental health issue. The rates of suicide in Pinellas County is growing, and it's more than for the state and also the Healthy People 2020 goal. Addiction or abuse could lead to behavioral issues. Access to healthcare. As stated earlier, people who were insured and who had healthcare coverage, even they could not see their primary healthcare providers because of the cost. This is a barrier that needs to be taken care of as soon as possible. Poor nutrition and physical activity. Lack of physical activity leads to obesity, finally leading to many other problems like heart disease, diabetes, and other complications. Pinellas County has a problem with obesity as indicated by the numbers earlier. Cancer and heart disease. In 2011, cancer was the leading cause of death in Pinellas County, and lung cancer was the main form of cancer. The number of active smokers in Pinellas County is increasing, which further leads to lung disorders. Sexually transmitted diseases like chlamydia, syphilis, gonorrhea, rates are going up in Pinellas County, and they are higher than the rates for the entire state of Florida. The rates are more pronounced in women ages 15 to 34, and it affects the pregnant mother as well as the child. That's all for my presentation. Thank you so much.